our 67-year-old patient with a left hip fracture, we are choosing to use a rolling walker. It's going to provide the greatest support and stability for our patient and allow for them to partial weight bear or weight bear as tolerated through that left leg. We're going to do a modified 3-point gait, which I'll show in a couple seconds. First, the most important thing to fit the walker is when you're standing here inside, your wrist creases are going to be right here at the handles, or your elbow is going to be slightly flexed. You can see that there too. And then to fit, if you need to change it, it's easiest to flip it here. And there are little pegs right in here. You can push them in and move the legs up and down on both sides. And then to fold, you're just going to press here on these handles and like that. It's nice and easily to transport, store. And to get it back out, you just press again, flip it out. Okay, now I'm going to show how this gait pattern is going to work. Basically, you're going to move the walker forward, slide it forward, and then step with your bad leg or the involved side, so in this case the left side. And then you're going to put your weight in through your hands, so you're bearing through your hands onto the walker, and then putting as much weight as you can onto this left leg, as much weight as tolerated. So here, bring it forward, and then bring your good leg through. And so slide again, affected side forward, lean into the walker, and bring that leg in, just like this. Okay. And then so to turn, we're going to make sure that we aren't pivoting, and we're going to want to take small, wide turns, just like so. And you're going to also make sure you're turning to the good side. So in this case, we're going to turn to the right. Making sure always to put your weight through your hands, like so. And I'm back here. I'm going to be the aide, and Dallas is going to show what the physical therapist would do to get the patient out of the wheelchair and show them how to use their walker.
So now we'll demonstrate how to get up from a chair, get to the walker. The first thing we need to remember is that patient safety is the most important. So the first thing we do is always remember to lock the wheelchair if they're getting up from a chair, if not a normal chair. Make sure the chair is stable and not sliding on the ground. And the second, a gait belt. Anytime we're in contact with a patient, we want to make sure we have a gait belt on. It's just for their safety, and it gives us a place to hold on to them. So applying it, have them lean forward, reach around, and raise their arms up. You want to make sure you get it around their waist, but you also